Under a Republican president and a Republican-controlled Congress, the GOP was unable to successfully repeal the Affordable Care Act. So where does the future of this law stand? What do you say to the nearly 30,000 South Dakotans who signed up through healthcare.gov? We begin with Mr. Johnson on this question.
Well, first off, I want to say to anybody who has pre-existing conditions that, of course, I acknowledge that whatever system we have has to cover those pre-existing conditions. And that's a commitment that I'm happy to make. I think if we're really going to improve health care, we've got to start working better on some long-term strategies. We're not doing a good enough job with wellness. We're not doing a good enough job with case management. Over time, those can bend these cost curves, and they can result in billions of dollars of savings to our country and to taxpayers, and an incredible increase in the quality of life. I think we also need to do a better job of contracting with providers. As Chief of Staff, I had a lot of experience in not just paying providers to run the machine one more time, but entering into some more innovative approaches where we start paying providers for outcomes. Make sure that their interests are well aligned with the patients and well aligned with the employer or with the government that's helping to pay for that. Now, I don't think we are going to get that kind of innovation, that kind of progress with a one-size-fits-all solution from Washington. I mean, what we've got right now gives us an opportunity to all fail together. We know it's not working. You're not happy with what you're paying for health care. I'm not talking to anybody who's happy with what they're paying for health care. Affordability is a real problem. And I think we can use the power of states, give them unfettered flexibility, or at least an incredible amount of flexibility for them to innovate and find new ways to do this case management, to do this wellness, and to do this working with providers. I think if we give Kentucky and Minnesota and Tennessee an opportunity to innovate, we're going to find we get much, much better outcomes.
All right, thanks, Mr. Johnson. Mr. Bjorkman.
Thank you. Well, we already have that kind of innovation that Dusty's talking about with Medicaid expansion. South Dakota, under Dusty's time in the governor's office, just rejected it. And I mentioned that earlier, how costly that's been. Devastating impacts all across our communities because we're not treating mental health and then the addiction that often grows into that. And it rips across the fabrics of our community. So, the Affordable Care Act, an imperfect first attempt to get the kind of health care that every American can see a doctor when they're sick and can afford it. So the basic problem that we have is health care costs too much and it leaves too many people out. The current administration and the Republican Party promised us better, cheaper health care that would cover everyone. That promise has not come through. The Republican House couldn't get through the Senate a plan, and it's a mercy that it didn't pass because it would have been devastating, taking 23 more million Americans off the rolls of health care. So, three big things. One, we've got to get everybody into coverage as early as they can and get them accessible to treatment and have them pay what they can pay. Two, the biggest drivers of health care beyond the fact that we leave so many people out of timely care and then we pay dearly for it all through society is big pharma and the skyrocketing costs of pharmaceutical care, and then the high costs of insurance administration. I want to just touch on those briefly. Congress has prohibited our Congress from negotiating with using its bulk purchasing power to lower the cost of pharmaceuticals with big pharma. That's got to change. It's solely a factor of the special interest control that big pharma uses over Congress. And so we need to send people who will push back that kind of special interest control. The second thing is, when Congress tried to lower the costs of our drugs so that we could pay in this country what Europe and Canada pay instead of the 2 to 7, sometimes 10 times more than that, the Senate struck it down, and it was bipartisan. 10 Democrats joined with Republicans, but every one of them got big money from big pharma who voted against it. So we've got to stand up to those costs and address them, and we've got to address health care costs in terms of insurance and offer a public option to people so they can buy into Medicare if they can't have affordable health care otherwise.
Thank you. We need to move on to the next question. Thank you.